Hello, and thank you for listening to today's episode of JAT Cast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. This month, we will feature 2 article reviews over 2 short episodes from the special thematic issue on ankle sprains and instability. For the first episode, I will summarize the article titled Lack of Medical Treatment from a Medical Professional After an Ankle Sprain by Dr. Tricia Hubbard-Turner from the University of North Carolina at Charlotte. As a reminder, the articles discussed today can be found on the JAT website, natajournals.org. And please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. Let's survey the scene. Lateral ankle sprains have consistently been reported as the most common musculoskeletal injury to occur in sports. Furthermore, a large percent of individuals who stay in an ankle sprain develop chronic ankle instability, also known as CAI. In fact, depending on the specific sport or activity, between 20 and 75% of people who sprain their ankle will develop CAI. Over the past decades, ample evidence has emerged to describe the long-term consequences of CAI. Common consequences are decreasing physical activity, decreased self-reported function and health-related quality of life, and the development of ankle osteoarthritis. Despite the high occurrence and negative long-term outcomes, lateral ankle sprains are often viewed as benign injuries with no consequences that stem past initial pain and loss of function. This notion is supported by a study by Hiller et al. That found that less than 64% of individuals with a lateral ankle sprain seek medical care. It appears that the high rates of developing CAI may be associated with the lack of medical attention following the initial sprain. In addition, not seeking medical attention, individuals who did in fact seek medical attention may actually not receive the most appropriate treatment, rehabilitation to prevent the development of CAI. Both of these theories to explain the high rates of CAI are further detailed in a recent consensus statement of the International Ankle Consortium. In order to further investigate these theories, the purpose of the article by Dr. Hubbard-Turner was to explore the relationship between self-reported medical attention and self-reported function. A total of 175 individuals with CAI participated in this study. Individuals were characterized as having CAI if they met the criteria established by the International Ankle Consortium. Specifically, participants within the study had a history of at least one significant lateral ankle sprain that occurred at least 12 months prior to study enrollment. The initial lateral ankle sprain had to be associated with an inflammatory response that resulted in at least one interrupted day of desired physical activity. In addition, participants reported either a history of feeling of giving way, instability, or repetitive sprains to the involved joint. Once enrolled in the study, participants completed 2 questionnaires. The first questionnaire measured the initial treatment and management received for their lateral ankle sprain. The first questionnaire read as follows. Please answer the following questions in regards to your first ankle sprain. When did your first ankle sprain occur? Did you seek or receive medical treatment for that ankle sprain? If yes, who provided your treatment? Was the initial ankle sprain immobilized, examples being a wrap, brace, or cast? If yes, what type of immobilization? Were you provided with and did you use crutches for the initial ankle sprain? Did you perform rehabilitation for the initial ankle sprain? If yes, how long did you perform rehabilitation? If yes, who supervised your rehabilitation? And if yes, what types of exercises did you perform? Since your first ankle sprain, have you sought medical treatment for subsequent ankle sprains? For the second questionnaire, all participants completed the Foot and Ankle Ability Measure, or FAME. The FAME has 2 subcomponents which estimate perceived ankle function during activities of daily living and sport. Out of the 175 participants within the study, 64% did not seek medical care after their initial ankle sprain. These individuals did not pursue rehabilitation, use immobilization, or crutches after the initial injury. For those who did seek medical care, with the number of subjects being 63, 86% of those individuals sought care from a certified athletic trainer. All of these individuals used some form of immobilization and pursued a rehabilitation program, with a large percent of individuals completing an intervention program comprised solely of range of motion and strength exercises. Of the individuals who sought medical care, but not from an athletic trainer, were not referred for rehabilitation, but were rather provided instructions for at-home rest, ice, compression, and elevation. A large difference in self-reported function was found between individuals who sought medical attention and those who did not pursue medical care. Individuals who did not seek medical care scored between 8 to 9% lower on the FAME, ADL, and SPORT subscales when compared to participants who reported seeking medical attention. Furthermore, individuals who did not seek care reported almost 3 more ankle sprains and had a higher monthly frequency of experiencing a bout of instability than individuals who sought medical care. The results of this study support Dr. Hubbard Turner's original hypothesis that participants who did not seek care after an ankle sprain would have worse self-reported function than individuals who did seek care. This study reconfirms that presently, ankle sprains are often viewed as innocuous injuries that only need time to fully heal. The present data demonstrate that this notion is far from the truth and that the lack of medical care most likely contributes to the development of CAI and long-term consequences associated with the condition. Though the participants who did seek medical attention reported higher function than those who did not, these individuals were still identified as having chronic ankle instability. This suggests that the exercises within the rehabilitation prescribed by the healthcare providers improved function, but did not fully mitigate characteristics associated with CAI. The 2 most common types of exercises reported by participants within the study were range of motion and strength. Both types of exercises have been shown to be important in improving impairments associated with ankle sprains. However, evidence also suggests that other types of interventions, such as manual therapies and balance training, may further improve impairments and possibly prevent CAI. Overall, the study further provides evidence to support efforts to further educate both patients and clinicians about the long-term consequences associated with ankle sprains, and that appropriate prevention and treatment strategies are imperative to diminish poor outcomes. Well, that is it for today's JAT cast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening and keep a lookout for part 2 of this JAT cast episode.